President Trump invoking the Defense Production Act to stop the export of crucial medical supplies leaving the U.S. Ainsley.
Yes, that's right, Brian. Just last night, the White House Chief of Staff Mark Meadows and Senator Chuck Schumer, they sat down, they talked about how to implement the act, even discussing a czar to maybe oversee production and distribution.
Here with more is the Defense Production Act Policy Coordinator at the administration, Peter Navarro. Peter, good morning to you. Thank you very much for joining us from the White House.
Great
so
to be
tell
with
us
you this
more
morning.
about the conversation between, you bet, between Chuck Schumer and Mark Meadows last night. What is Chuck Schumer interested in?
I'll let Mark and Chuck report to you directly, but the issue is basically how to use the Defense Production Act productively to save lives in America. And really, there's three ways to use it. One is in the allocation of resources we have, which is to make sure that the supply chain has enough so that we can make the ventilators. We don't want to run out of components in the supply chain. We also, in terms of allocation, want to make sure that when we manufacture something, it gets to the right people. The other second thing is mobilization of the industrial base, and that can mean repurposing factories like GM and Ford are now turning their auto production into making ventilators. And the third thing basically is cracking down on the kind of black market and profiteering that has arisen. And so far, President Trump has signed numerous Defense Production Act orders acting on all of those fronts. A GM order to get them to make ventilators, an allocation order to help the ventilators manufacturers have enough components. And we are locked and loaded right today at the border with Customs and Border Protection, ready to crack down on black market profiteering in this country. And the Department of Justice, Bill Barr, has already busted somebody in New York and New Jersey, and that within 24 hours of grabbing 80,000 masks, those were get sent to the front lines of the war on the virus in New York. So that's what the Defense Production Act debate is all about, and the president is using it every day, using his orders.
Right, and I know you're doing a great job behind the scenes just trying to get the whole world together, Peter. Let's just talk about an Axios report that yesterday in the Situation Room, you walked in very proud of acquiring more hydroxychloroquine, and Dr. Fauci was very negative on it, and evidently you guys had a heated exchange. Can you shed some light on that for us?
Sure. There was no pride there. It was simply on Saturday there was a meeting of the task force, and the question before the task force was this, Brian. We have 29 million tablets of hydroxy in FEMA warehouses, and the question before the group was, should we surge that hydroxy into the hot zones? And the task force unanimously voted to do that with the proviso that this can have side effects and that it has to be dispensed not by the federal government but by the patient-doctor relationship. The third thing I can tell you about the meeting and the discussion was there was some discussion about the numerous studies that are out with regard to efficacy. It is true there is no 100% proof that this works. On the other hand, there's numerous studies that are coming out now, including the latest one, which is randomized, that shows therapeutic efficacy. The other thing I should tell you is that in the city of New York, if you're a patient in the New York Health and Hospital System, which is 11 hospitals run by Dr. Mitch Katz, any patient, virtually every patient that presents with COVID-19 is given a cycle of hydroxy. And when I asked Dr. Katz why, was it because the federal government was telling you to do that or because he thought it may work? And he said very clearly that it may work. So that was the sum and substance of the discussion. The media is trying to blow it up as a big debate, but I can tell you that within the room, the decision was a sound one, and it was unanimous.
So what does Dr. Fauci want? Does he want more testing?
Look, I'll let Tony speak for himself. You've seen he takes the view that it's important to have controlled studies, randomized studies, and to go through the science and come to the end and determine what's going on. And as a social scientist myself, I totally agree with that. But there's also the point of view that we are in war. President Trump is a wartime president. In the fog of war, we might take more risk than we otherwise would. And given the track record of the drug over many, many years treating malaria, and there are side effects, but it's been used a lot in lesser doses, the decision's been made by many doctors to prescribe it, and if it saves lives, that's a beautiful thing. I think history will judge who's right on this debate, but I'd bet on President Trump's intuition on this one because of all the doctors I've talked to and all the scientific papers I've read, and they're about this high.
Yeah. Of course, that's a conversation that every patient needs to have with their doctor to figure out what is the best care for them. Peter, there's a story in the New York Post that apparently the administration is considering suing China because toward the end of last week, we heard about, hey, 3M is trying to, they're keeping masks that they're producing in different countries. According to this story, it says that as early as January, China was preventing any of those masks that 3M was producing from leaving China. And so now the administration is thinking about somehow brushing back at China, saying, you obviously probably knew that there was a need there. We needed stuff. What's going on behind the scenes?
Sure, Steve, a couple of things. First of all, I've been part of no discussion that's talked about suing China on this. The separate issue, though, is a serious matter. We know that China knew about the virus as early as mid-December. We know that for a period of about 5 to 6 weeks, they hid the dangers from the rest of the world, even as Chinese citizens were flying around the world, seeding the world with the virus. But what looks like from the data, Steve, and this is a serious matter, it looks like during that interval, China was basically attempting to corner the market in personal protective equipment, including masks. So they were buying large quantities of masks, gloves, goggles, respirators from the rest of the world at a time when the world was still sleeping with respect to the dangers of the virus. And the Chinese customs data shows one statistic that I think every American should sit up and really stare at. 2.2 billion masks China bought between January 24th and the end of February. And right. Look, if Americans are getting infected because they don't have masks, Italians are dying because they don't have masks, healthcare professionals are going down. And I think if those statistics are telling a story about China basically going out and trying to corner the world market in PPE when they knew the dangers and didn't tell the rest of the world, I think that's a significant discussion we need to have at least after this is all over, because that's a serious matter.
So Peter, I don't know if you saw the top of our show, but we interviewed the CEO of Maimonides Medical Center in New York City, and he needs everything, and he says it's emergency, and there is a belief that a lot of stuff you're sending is not getting directly to the hospitals. There's some type of bureaucratic holdup in the execution of the PPEs and the ventilators. What is the system, and is there any way to cut through that red tape and get it to Brooklyn?
Well, we're skating to where that puck's going to be even as we speak. For example, in the New York Health and Hospital system, what we've done with that system and others is to get a 30-day list of everything they need and then to deliver those whatever they need directly to the hospital. So I understand what you're saying, and we're shifting. Unfortunately, a lot of the stuff early on that we had been sending to the warehouses up in Albany that's run by the state wasn't moving with all due speed down to the hospital system. But Brian, this is a moving target, and as we learn about that logistics there, we're helping to fix them here. The other thing I should tell you, and to give comfort to the people in the New York, New Jersey area, is we are massing on point this week, because we know this is the most crucial part of the war against the virus in the New York, New Jersey area. And we are throwing everything we can at it in a tactical and strategic way to make sure that we minimize the casualties in this war. And I couldn't be prouder of this president. I couldn't be prouder of all the private companies that are sending stuff here. And I couldn't be prouder of the people on this team at FEMA, HHS, Vice President's Task Force.
Peter Navarro, thank you so much.
Take care. Take care of yourselves
Thanks,
in that
you
city.
too.